I'm Emma, and Ben wanted me to help kind of ask him questions and talk a little bit about kind of the actual medical history, I guess, of what the tumor has been. So, because I think from my own perspective as a caregiver, it can be really helpful sometimes to remember that it's different for everyone and that you can't compare, even though two people might have the exact same disease. It helps to remember, right, that no one else's circumstances are going to be exactly what yours are, so let's hear what yours are.
It is categorized as a grade 4 brain tumor, a malignant brain tumor, fast growing. And the only other detail about mine is the genetic tests revealed that it is what's known as MGMT unmethylated and IDH wild type, which these are labels of certain mutations that the tumor has. And the reason they test for that when they do your biopsy is because it tells them information about how effective the chemo is going to be, or in my case, how ineffective. So the test showed that I would have a lower chance of getting any benefit from the standard chemotherapy treatment that's available for this tumor.
And then, do you know how to talk about like where it's located in
your
your brain?
So the tumor is located on the right side of my brain, I think mostly in the frontal lobe, but on the edge of the parietal lobe is my.
Well, and what I remember hearing from the doctor well after dealing with surgery and the surgeons is the oncologist was telling us how much bleeding there was inside your brain prior to your surgery. That was one of the really scary things going on there. So getting your surgery done like a week after diagnosis was really important. The standard of care for glioblastoma is like easily Googleable. It's not complicated, but would you talk for a minute about what were your own, the symptoms is not the word, but side effects is the word that I'm looking for.
The exact type of radiation I got has a long name. It's technologically kind of cool.
I don't remember what it was
called.
I
don't remember.
No.
I remember what it isn't because a lot of people have asked me, proton.
Oh yeah, like proton whatever, or like gamma
ray. So we know it's not the proton, it's not gamma ray, it's something.
It was
something even fancier.
Anyways, it was the standard of care. It was radiation and chemo.
So you get
but how did it feel? Because I feel like that is something that other people get kind of concerned about. It's like,
okay, so for me the side effects I think were more mild than for a lot of people. I tolerated it quite well. But they told me to expect to get really tired toward the end of the radiation, or that I would feel, if I felt side effects, it would be closer to the end because you're getting 6 weeks of radiation. You're taking chemo the whole time, every single day, for however many days that is. And so I was expecting to feel really tired. And the chemo, you take anti-nausea medication while you're on that. And the only time I got really sick was one day when I missed a dose of that medication. And I did actually throw up on the way out of a hospital visit.
That's right. That was awful.
But
that was terrible.
Other than that, it was, and also the chemo causes constipation. That was probably my worst side effect, was actually the constipation on some days when I didn't medicate it correctly. I didn't adjust. It takes some time, once you figure out, I think, to take the right amount of laxatives and get that worked out, it's okay. Otherwise, it can be very uncomfortable and unpleasant. So I would say that was my worst side effect of this whole treatment, was the constipation, probably.
And I think, like, at the time, it seemed like your side effects were so much calmer than what we expected, for sure.
Yeah.
And at the same time, looking back to like photos and remembering certain experiences that we had, like, you were tired. Like, you were not the same as you were, say, like 6 months later. Like, it was still significant, but it wasn't crazy. But
the other thing to discuss before I move on to the adjuvant treatment was recovering from surgery.
Mm-hmm.
And I think I also recovered better than a lot of people. I was fortunate that I did not have any brain damage. I did not have any physical therapy. I did not have any what do you call it? Basically recovery treatments, which is rare. I think most people have a little more, at least temporary loss of function of some sort that happens as a result of the surgery.
That's true. Yeah.
So I was actually, I was out of the hospital within a few days, and it's not that it was easy at all. It took a while. From surgery, I was on a lot of medications, and then slowly weaning off of those as the radiation started. So, but as I got going on the radiation, I was pretty much off. Shortly after that, off the steroids and off the oxycodone, which was good because you wouldn't want to have oxycodone and chemo both causing constipation at the same time.
Also true. But then, so let's fast forward a little bit, because you finished that whole cycle and then did the normal chemo for 6 months.
Yeah, there's a little break. There's a little break after.
There's a little break, but
to give you some recovery time.
They essentially then just put you on 6 months of chemo, and it's the same chemo that you were on.
Yeah.
During the intensive period with radiation, and that was. Remind me.
5 days
I don't
of the
even
month.
remember. 5 days out of the month.
You get 5 days, and then you take 25 days off, something like that.
Yeah.
Don't quote me on that. But,
and you did all of that just by itself. No, you didn't, because
I was also wearing the Optune.
Because you were wearing Optune for about October, November, December, January.
Yeah, I started it a little bit before the chemo.
February. When did you go off of Optune?
And then I went off of it in the spring after my second MRI. So I had an MRI the following spring after the 6 months of chemo, showing a recurrence, meaning the tumor was growing again. Mm-hmm. And then a follow-up MRI called a spectroscopy perfusion MRI, which is more detailed, just to make sure that it kind of tells you a little more information. Because if you get an MRI that shows swelling in the brain, that they often might say, well, that's probably the tumor growing, but it could be actually an effect of the treatment actually damaging the tumor. It could also cause swelling. So they had a follow-up MRI that pointed in the direction of it being the tumor. Yeah. And then my doctor advised me to stop the Optune because she didn't think it was working.
Yeah, well, yeah, and she asked basically, like, do you want to keep using Optune even though the tumor is growing? And then you opted not to. And since we had a really detailed, really concrete result show that the tumor was growing by enough percentage that what was currently happening wasn't working, we decided to go ahead and go off of it. So once Optune was done, you got to grow your hair back, and so that was April, and you started with Avastin all of a few weeks later, so it was May, and you did Avastin for May, June, July, August, September, October, November, and it was the first week of November when you had your last Avastin. So that was 7 months of Avastin. Your MRI that you had in June was the best one, and so that was pretty exciting.
Yeah. So basically, it's a replacement for using steroids. So as soon as I had my recurrence in spring, they did get me back on the steroids briefly. But then they said the Avastin could be more effective in reducing the swelling and have maybe fewer side effects than the steroids. It's not as convenient because it is an infusion you have to go in and get at the hospital. But my experience with it was, it was fine. I mean, it all depends on probably what hospital you go to and all that type of stuff. Really, to me, I had a lot of really good experiences in treatment because I really liked a lot of the people at the hospital and a lot of the people who worked with.
I think one other kind of factor and context for your whole experience too is that actually we live a couple miles from the University of Washington Hospital at Montlake, so
that makes it really easy.
Your ability to go in and get regular infusions, all it meant was hopping on the train and going 2 stops or whatever, or having someone drive you 10 minutes. So that colors a lot of our experience
Yes.
too. If we
Well,
look
full disclosure is that I was driving myself probably for a lot longer than I really should have, but
also true.
either way,
But
I was
now-
getting there easily.
But now he's not really able to drive anyways. So,
Nope.
but I think that's an important piece of the context where it makes our experience easier and like not as heavy a lift to make all the treatments happen for sure.
So briefly, Avastin is the brand. That's the brand name of a very difficult to pronounce drug. It's in the immunotherapy category. It's called a monoclonal antibody, and it is actually an effective treatment for some other types of cancer, as far as like really affecting the tumor. For glioblastoma, it's been approved only as a symptom management kind of. People usually get it toward the end. It's not really expected to extend life expectancy. However, according to the clinical trials, but I was one of, I think, a very lucky few, because after I started the Avastin, I had this unexpectedly awesome MRI.
Yeah.
My doctor did say, well, in a very small number of people in the clinical trials, or a small number of patients, that it does actually have more of a benefit and can even affect the tumor itself a little bit, not just the swelling. And so for me, it seems like I was ready to just make it through the summer and maybe part of the fall. And I didn't think I'd still be here now this winter. But it seems like it works a lot better.
And so November, like I said, the first week of November was the last time he went in for an Avastin infusion, and then you had your MRI about 2 weeks after that, and that was kind of that was the final MRI. There won't be any more, most likely, because that also showed, just like back in April, that there was significant tumor growth in spite of the treatments happening. So clearly Avastin stopped working, which is statistically what's likely to happen, even if there's a good result. Like on his June MRI, it also wasn't surprising that by November it kind of stopped being as amazing. So
yeah, we were very lucky that it extended my life at all, and we knew it wasn't going to work forever.
Yeah. So then, and basically that was it for treatment.
Yeah, I was given an option to, if I really wanted to be super aggressive, I could have tried a different chemo or a different chemo in combination with Avastin, but it wasn't really optimistic. I opted to go for hospice instead and focus on quality of life.
Yeah. So right now you're not on, any chemo that's going to make you sick, and you're not on a whole bunch of like anti-nausea meds and the whole thing that came along with chemo. So
I'm not wearing magnetic pads on my head.
Yeah, there's like the days that we have together are pretty like simple and straightforward, like in terms of how that whole medical scene is going right now. And I know that that's probably going to change, but we get to just kind of enjoy our normal lives.
Yeah.
Have our meals and
I'm gonna be able
have
to
our dog walks and
gonna be able to stay at home. I'm not probably gonna have any more reason to go to the hospital.
Yeah.
No more MRIs, no more blood tests, anything like that.
Yeah, that's true.
And if something comes up, like some really promising clinical trial or a new treatment, it's not like you're forced to stay on hospice once you go on it. You can go back off it.
It's true.
It's just for insurance purposes, it will either pay for hospice or it'll pay for active treatment in the hospital. So if you're getting anything that's officially considered active treatment, you can't do that and be on hospice. So if I wanted to get MRIs or blood tests, which there's no really reason for it, but if I did, then I would go back off of hospice.
Yeah.